Welcome. Today, we're diving into benign asbestos pleural effusion, a lung condition linked to asbestos exposure. We'll explore what it is, how it develops, and what can be done about it. Benign asbestos pleural effusion, or BAP, is, as the name suggests, caused by exposure to asbestos. Asbestos, a naturally occurring mineral once widely used in construction and manufacturing, releases microscopic fibers into the air when disturbed. When inhaled, these fibers can trigger a variety of lung diseases, including BAPI. It's important to remember that BAPI isn't cancer, but it's a clear sign of asbestos exposure and increases the risk of developing other asbestos-related diseases later in life. Let's talk about what happens inside the body. When asbestos fibers are inhaled, they travel down to the lungs and can reach the pleura, which are the two thin layers of tissue that surround the lungs and line the chest cavity. These fibers irritate the pleura, causing inflammation. This inflammation leads to an accumulation of fluid between the pleural layers, creating what we call a pleural effusion. This fluid buildup can compress the lung and make it difficult to breathe. The incidence of BAPI is directly related to the level and duration of asbestos exposure. Individuals who worked in industries like shipbuilding, construction, insulation manufacturing, and mining are at the highest risk. The latency period, meaning the time between exposure and the development of the effusion, can be quite long, often ranging from 20 to 40 years. This makes it challenging to trace back to the exact source of exposure. So, how does BAP present itself? Common symptoms include shortness of breath, chest pain that can be sharp or dull, and a dry cough. Some individuals may also experience fever or unintentional weight loss. However, in some cases, BAP can be asymptomatic, meaning it doesn't cause any noticeable symptoms and is only detected during a routine chest X-ray. Diagnosing BAPI involves a combination of medical history, physical examination, and imaging tests. A chest X-ray is often the first step, which can reveal the presence of fluid in the pleural space. Further investigations may include a CT scan of the chest, which provides a more detailed view of the lungs and pleura. A thoracentesis, where a sample of the pleural fluid is drawn and analyzed, is crucial to rule out other causes of pleural effusion, such as infection or malignancy. Sometimes, a pleural biopsy is performed to examine the pleural tissue itself for signs of asbestos-related changes. While BAPI itself isn't cancerous, it's classified based on the presence and amount of fluid, and whether other asbestos-related changes are present in the pleura. It's generally considered a benign condition, but close monitoring is essential due to the increased risk of developing more serious asbestos-related diseases. The primary goals of treatment for BAPI are to alleviate symptoms and prevent complications. If the effusion is small and not causing significant symptoms, observation may be all that's needed. For larger effusions that cause shortness of breath, a thoracentesis can be performed to drain the fluid. In some cases, a procedure called pleurodesis may be considered, which involves irritating the pleural layers to cause them to stick together, preventing further fluid accumulation. Importantly, treatment also involves regular monitoring for the development of other asbestos-related diseases. Prevention is key when it comes to asbestos-related diseases. The best way to prevent BAPI is to avoid asbestos exposure altogether. This includes following strict safety regulations in industries where asbestos is still present, such as demolition and renovation work. Proper protective equipment, like respirators and protective clothing, should always be used. If you suspect asbestos in your home or workplace, have it professionally inspected and removed. The prognosis for BAPI is generally good, as it is a benign condition. However, it's crucial to understand that BAPI is a marker of asbestos exposure and significantly increases the risk of developing other asbestos-related diseases such as asbestosis, pleural plaques, and mesothelioma, a rare and aggressive cancer of the pleura. Therefore, individuals with BAPI require lifelong monitoring by a physician experienced in asbestos-related diseases. Ongoing research focuses on developing new diagnostic tools and therapies to better manage asbestos-related diseases and improve patient outcomes.